And I want to say welcome, everyone. Welcome to Health Equity and Access Response Team in DuPage County. Our goal being together is optimal health and well-being for all our neighbors, where no one is disadvantaged by race, origin, or other identity. I want to say a couple of housekeeping things. And before I do that, I want to give a heads up to new arrivals, newcomers, first timers on this call today. I will be inviting you to introduce yourselves in just a couple of minutes, to share a name, an affiliation, and what brings you to this team. This is a Zoom meeting this morning, so this is being recorded and it will be posted at YouTube, but in a departure from some of our earlier practice, it's not being live streamed. So the key thing now is that it's recorded and it will be posted for viewing afterwards. Today, we're going to cover a lot of ground regarding planning for the future. And we're going to start with our core identity as a group that reviews data and data that's disaggregated by race. And then we're going to move into a number of discussions. All of them are going to be discussions that need to engage all of us regarding short-term, medium-term, and long-term steps for our future. So let me start then. I gave the heads up on welcome to new folks. What I'd like to do is invite those who are with us for the first time today to please introduce yourselves, your affiliation, and what brings you to the Heart Table. You know, I can pick out a couple of folks, so I don't want to force you to go first, but Lindsay, I would welcome you to the microphone.
Sure. I was about to go first anyway, so no problem. My name is Lindsay Robinson. I'm from the Ames Center for Independent Living. We provide disability services to DuPage, Kane, and Kendall counties. So just joining the team due to Dave's invitation to provide disability or a perspective from the disability community to the group. So thank you for the invite.
Thank you, Lindsay. And because it's relevant to a conversation that we're going to have later today about our future, I wonder if you'd mind talking a little bit about what are you mandated to have in terms of board and staff at AIM CIL?
Sure. Yeah. So our agency is a little bit different than other disability service providers due to our federal mandate to have at least 51% of our board and staff be people with disabilities. So we are people with disabilities serving people with disabilities. So, you know, not only do we serve a community of folks with disabilities, but we have disabilities ourselves for the most part. So interesting perspective, you know, as an organization.
Thanks, Lindsay. And so at the risk of making an error here, Dawn, have you been with us before? You have been, of course. So forgive me. Are there folks who've not been with us before who we would like to introduce? Annie, how about you? Annie, you're muted. There we go.
Hi, I'm Annie. I'm with World Relief DuPage, and I'm, just coming into this meeting as a first-time person. Amanda, my manager, normally has tried to come in the past, so I honestly don't know a whole lot of what you've discussed in the past, but I'm happy to sit in and just contribute as I'm able, but more or less, I work with the initial clients who come through our resettlement process to ensure that they have their screenings and orientations within, those recommended timeframes. So we have obviously seen a lot of clients and continue to see many on top of the Ukrainians. So yeah, I've been quite busy.
Annie, it's good to have you here. You're going to get the idea pretty quickly with our first presentation, and your voice and World Relief perspective is going to be really important for us in our discussion and deliberation. So I'm glad that you're here.
Thank you.
And I want to invite Theodia. Theodia, if your microphone is on and if you would introduce yourself. name, affiliation, and what brings you to the table.
Actually, there's a comment in the
Oh,
chat.
mic not working. All righty.
Looks like it's Samantha working with Theodia. Welcome, Samantha.
Thanks. And so workaround, it would be just great if you dropped some info into the chat about you. Many of us know you, but it would be good for everybody to have that reference point. Is there anyone else who's with us for the first time?
Morning. Mike. How are you?
All right. Thanks newcomers. Good to have you here. And so then let's go ahead and move into our first agenda item. And Dr. Chug, it's very good to have you here. And we welcome you to the microphone to share a data report.
Thank you, Dave. Good morning, everyone. Good to see everyone. Happy New Year. And yes, thanks for the opportunity. And thank you, Becky, for inviting me to reflect the data that we'll share shortly here. And thanks to Liz Murphy for preparing the graph that we're about to review here. And I really appreciate the wisdom of the ARISE grant work group to identify, really laser focus in on the most potentially actionable and relevant to this group, you know, given our focus on health disparities, particularly in racial and ethnic minority populations and those most disproportionately impacted by COVID-19. So we'll review those data. Becky, I'm guessing we're bringing up the few slides. But I can start by saying that unfortunately, we still have our work cut out for ourselves. We have very significant disparities. So perfect. Thank you, Becky. So just to walk through what we're seeing here, and then we'll talk through the interpretation a little bit more. So here we have COVID-19 related death rates, not counts, rates, which does allow for a more apples to apples comparison across racial and ethnic groups, and then further broken down by age group. So this reflects death rates by race and ethnicity in DuPage County residents age 60 and older. And that too, just for 2022, which again is even more laser focused, really looking at, because as we know, 3 years into the pandemic, we've gone through so many circumstances and the landscape has been so dynamic, especially with that first year, an immune naive population, no vaccine, to then in 2021, gradual rollout of the vaccine, and then sort of mixed uptake with evolving recommendations based on, progression through the pandemic and evolving vaccine products with now the booster doses being recommended and widely available. So given that in 2022, where we're at is we'll look at sort of left to right by race and ethnicity. So our blue bar here reflects Asian individuals 60 and older, and then the gray bar is our Black and African American population 60 and older, which is strikingly high with our mortality rate there of over 400 per 100,000 population. And then our yellow is the white group of residents 60 and older, deceased individuals. And then then we move to ethnicity reflected by the orange bar of Hispanic or Latino person 60 and older. And then the green bar is those not Hispanic or not Latino. And then the blue bar is our overall group of individuals 60 and older, the mortality rate of those individuals 60 and older in 2022. And I'd like to mention also that just given how early we are, that this graph reflects mortality data through December 5th, 2022, since we don't yet have the full year of data, but thought it was worth, and again, I appreciate the wisdom of the group in requesting and really laser focusing on the potentially most actionable data. So if we could move to the next slide, please, we'll just talk through what does this mean? Thank you. So as we just saw, very graphically illustrated, the COVID-19 related death rate for Hispanic or Latino DuPage, that was that orange bar, DuPage residents age 60 years and older, is 94% higher than the DuPage County not Hispanic or not Latino rate for that same age group. So that's one very clear disparity identified. Then the second bullet point is the COVID-19 related death rate for Black or African-American DuPage County residents age 60 years and older is twice as high as the DuPage County white rate for that age group, again, in 2022. And then finally, just a little bit of context that discrepancies between aggregate death rates, which are not included in this graph, which are basically mortality rates where they're not broken down by age group, versus comparison by age group. So those discrepancies may be explained by certain populations in DuPage County skewing younger. For example, 8% of the Black population and 5% of the Hispanic Latino population is age 60 years or older versus 19% of the white population, or 14% of the Asian population and 19% of the not Hispanic or not Latino population are 60 years and older. So those proportionate differences can lead to sometimes the disparities getting lost if we're not breaking it down by age. So very important that we do look at the breakdown in mortality rate by age, particularly when we know that the deaths that are occurring that we continue to see are predominantly in our elderly population. So even within that elderly population, we're seeing these persisting, significant disparities by race and ethnicity. So wanted to provide that overview and then briefly talk through some just preliminary considerations for the group and more broadly for this group, talking about the landscape and some really, I want to say low-hanging fruit. They're not low-hanging, nothing's easy, but at least some more obvious opportunities based on what we, the tools and resources that we do have, particularly vaccines and treatment, as well as, of course, education and the other known preventive measures that can be very effective in helping to establish that layered approach of reducing transmission of illness and severe outcomes. But I'll pause for a moment for questions. And Michael, I see you have your hand up.
Michael, you're muted.
Sorry about that. I'm trying to digest the number. So you're saying that only 8% of the Black population and 5% of Hispanic is 60% or older versus the 19% of the white population?
Correct.
So we have an older population, among that group, and that's contributing to that slide before showing the higher aggregate number.
So no, actually what happens is, when we don't break it down by age group, then some of the disparities can be lost because of, one racial or ethnic group skewing younger or older. For example, the minority populations tend to be skewing younger. So the disparities in the older population might get lost. But since we have broken it down by age group, we are able to appreciate and see the visually recognize the disparities in that older age group of 60 and older. So this is just context for, as you may recall, we've shared graphs that we still have on our dashboard on our website, where mortality rates by race and ethnicity are not broken down by age group, and those disparities are not immediately obvious, but they are obvious in this graph that we just reviewed, because we have broken it down by age group. So we're seeing the mortality rates among each racial and ethnic group in that age group. So it's not lost because of any skewing. Does that make sense?
Yeah, so I guess I'm just really trying to be clear on it. So the 19% of the white population, I'm just going to
Is
take a
60 and
wild
older.
guess, 60 and older, is assuming that they've been in probably DuPage County a longer period of time. And some of the, let's say the Black or the Hispanic population is just moving to this area. So that would make why they would be, that would explain why they may be younger.
Certainly. I think that's certainly the dynamic, demographics of the county, I think, are certainly contributing to the different proportions that we're seeing here.
Okay. Has anybody looked into a little bit different angle as to home ownership versus rentals? Because those people tend to move around a little bit more, and it could be exposed to the virus a little more also because of the way they move around.
Sure, absolutely. I mean, and we would defer to the group, and I think it's a good point at that granular level. But at least for purposes of tracking residents, both tenants as well as homeowners would be identified as DuPage County residents.
Okay, thank you.
Thank you. Any other questions before we move on to some opportunities and approaches?
Mika, I think your hand was raised, but did it go down? I can't see you on my screen right now.
Yes, I did have my hand raised. I did lower it, but I do have a question in regards to the data that we just saw.
Yes,
Did I miss any information in regards to those who were vaccinated with the mortality rates?
you did not miss it. It's not broken down among DuPage County resident data. We, especially in 2022, the majority of 2022, we have not, or actually nationally, I mean, there hasn't been the same level of individual case investigations and surveillance. So we don't have at an individual level the knowledge or data on vaccination status. But we have population level vaccination status. So, no, unfortunately, we don't have that for our specific deaths, but it is available at a more sentinel surveillance level, or, where CDC is looking at a select population. But I will say, thank you, Becky, for moving to the slide, just to help sort of tangentially address your question, Tamika. When we look at vaccination status in DuPage County by age group and across time, or across varying degrees of vaccination status, you'll see at the bottom there, the percent of population 65 years of age and older who's received at least one dose is 95%. So very impressive. Had a really robust response, and there was also a lot of prioritization and outreach and addressing of any barriers or anything. Then also similarly high for those 65 and older who have completed a primary series. Extremely impressive. Now, as the booster vaccine doses have rolled out, we've seen a significant, almost 40-point drop to where the most vulnerable population of 65 and older is only at a 55% coverage level of being up to date with COVID-19 vaccination, meaning being up to date with the recommended booster dosing. So there's a significant opportunity. There is quite a gap there in, where our most vulnerable population is at and where we need them to be. But I'll pause there, and then we have a few more resources we can review. But Asma, I see you have your hand raised.
Yes.
Just one more thing I wanted to add. This is Tamika again. So I asked that question to
Sure.
kind of determine how do we address the situation with this data that you have? What story is it really telling? Is it telling why are the Blacks, the African Americans, at the highest rate? If you're saying that are vaccinated, if I just saw what you mentioned about the 95% of the numbers that went up as far as vaccinations are concerned. So do we have any data, which may be further along in your presentation, in regards to why are African Americans in 2022 at the highest rate of death for COVID-19?
Right. No, and I think this graph that I just shared that's the only data that we have today to review, but it does help to begin to describe the problem, to relay the urgency with which we need to, delve further into this issue to understand it better, to be able to tackle any contributing factors that we can address to eliminate those disparities. And to reduce mortality rate, absolutely, in the most disproportionately affected populations, and then across the board. But to really focus on those the age group as well as the minority populations that are most severely impacted. So, but that I think is the charge, based on this initial sort of status check of where we're at and how significant and severe the disparities are, is that then we need to delve further into the data and better understand our opportunities.
Thank you.
Thank you. And Asma, I see you have your hand raised.
Yes, good morning. I joined a few minutes late, and I was wondering if you had a breakdown of DuPage County residents by race and ethnicity, similar to how you have it here by age.
You mean without the age breakdown?
Yeah, just because you're saying 95% of Black African Americans. So I was wondering, what is the population of Black African American in DuPage County?
Oh, I see. Yes. So for the 16 older, so you mean overall versus the 16 older?
Overall, because if it's, that I think is helpful in understanding the numbers versus just saying like, okay, this percentage of African Americans are dying or are affected disproportionately from COVID. So how many African Americans do we have in DuPage County? How many people are we talking about here exactly?
Right. And I guess, excuse me, and Becky, if you could please go to the previous slide, we just have the proportion of 60 and older within the those age groups. Sorry, the next slide that lists by, there we go. So if we were looking at the percent of those 60 and older in each demographic or each racial or ethnic demographic, that's what's in the third bullet. For example, 8% of the Black population is 60 and older among the Black population. But your question is more across DuPage County, and then to further, figure out the actual counts and the number of individuals that are reflected here. And I don't have that here, but I think that would be, again, a helpful activity by the group to help quantify.
The most recent data that I can see would suggest that we have about 5.4% of DuPage County population that is African American. And then if you look again at the percentage that are senior, then you could get to the actual number of individuals who are, and actually 60 and older versus 65 and older. These are not quite apples to apples, but nonetheless, that's how you would get to the number.
Thank you, Karen.
But 5.4% of roughly 930,000 people would be the number of African American residents of all ages.
Which has increased from around 4%, say 10 years ago, right? To Michael's point earlier, of changing demographics. So, all right, thank you for those excellent questions. So some suggested approaches and resources for the work group's consideration, and of course, this group more widely. As we just saw, we have a significant gap in our vaccination status in our most elderly population, and that's the highest of all age groups, the 55%. They're doing the best of all the age groups. So really across the board, we need to improve our coverage levels and persons being up to date and boosted. So here are some linked resources. The first one is a COVID-19 vaccination field guide from CDC with 12 strategies for your community. And then there's also a toolkit by Vaccine Resource Hub, which is a collaboration between CDC Foundation, and HHS that is specific to addressing health disparities and improving vaccine uptake among members of racial and ethnic minority communities. And that is available in English and Spanish. And then we also have some treatment access and update resources. One is from HHS, that's 2A, public education campaign with information and resources on about COVID-19 treatment in English and Spanish. And then from CDC, information on treatments and medications specific to COVID-19. And then there's an IDPH page focused on COVID-19 outpatient treatment. And then in addition, there's this recent data review from CDC that provides an update on COVID-19 related mortality, just for some sort of national metrics that could be that we could explore further at a state and local level. And then also preventive actions at an individual level, including this relatively recently developed template and posted by CDC on how to build your personal COVID-19 plan. Just so at an individual level, we can share this tool that helps folks kind of anticipate what would happen if you're positive, and what to do as far as treatment, and even before testing positive, make sure you're up to date, and just kind of think of those proactively at an individual level. So Kara, I see your hand is up.
Yeah, thank you so much. First, thank you very much for pulling together this data, because it really speaks to some questions that I think a lot of us had and were not able to answer. But one of the pieces that I find myself wondering about is the degree to which it is vaccination or lack of vaccination that is creating this disparity, or other social determinants or other issues that might be further complicating the picture. Do we still have the ability at the DuPage County level to look at rates of vaccination by race or ethnicity, or further to look at rates of vaccination by race, ethnicity, and age, to get to whether to really tease out whether the reason that we have such dramatic disparities is because primarily of lower rates of vaccination, or whether indeed there are other causes where we need to look more broadly, still continuing to emphasize vaccination, but also looking at other factors as well.
Sure, I think I don't know. I know we do by age group, and I know we do by race, ethnicity. I believe we do by both, but that I think that we'll need to confirm that. But Chris, do you recall offhand if we have that broken down by both age group and race, ethnicity? Is Chris still on? We can inquire, and I can let you know, but I imagine because I agree with needing to track that, to track our progress, hopefully will be really important. As we know, we're really low across the board. So hopefully we can only go up, but it'll be important to track those specific metrics.
Yeah, thank you so much. And we'll get the answer for the group. We'll sort of find out whether that data is available and share it after the meeting if it is. But I agree, my guess is it's multifactorial, and that when we look at the data, you'll see that because I've seen national level data, not DuPage level data, that suggests that any that many of the early gaps in rates of vaccination by race and ethnicity have either narrowed or in some cases been eliminated. And yet we still have these significant disparities, which suggests we need to continue to emphasize vaccination, but also then think about what the other root causes of the disparity really are.
Absolutely. And what's not broken out here is, whether or not there are underlying medical conditions and what the status of those are. And so 100% agree that, as we know, just even non-COVID health disparities are very much related to chronic disease and access and quality of care. And yeah, I think it'll be an approach that transcends COVID specific interventions, but includes them as well.
Rashmi, in years past, when we looked at this data now, I think when the health department was doing case surveillance and had so much more qualitative data related to some of the populations and the cases, we knew more about if there were diabetes or heart disease or some severe risk factors, and we focused on vaccine for those groups. So I felt like we had more information. And I think we're talking about how to get it now, but do you have any more comments on what you do know or anything that you've heard from the hospitals and any other information to share?
Specifically on health disparities, I know another, what we were hoping to have, but didn't have a chance to get to, that we'll be working on in the coming days, is to kind of see where we're at, because it is disheartening to see that even this far in that we have these, still severe health disparities. And so I believe they were worse in 2020, before vaccine, and then even in 2021, because now we have, for better or for worse, the benefit of not only vaccine induced immunity, but natural infection induced immunity. So, and then for some people, both, for many people, both actually. But what we hope to have in the coming weeks is, or we'd like to add the graphs that show by year what our mortality, what the disparities in mortality and age group have shown in 2020 as well as 2021, and then now compared to 2022, to see, are we making any improvement? Are we making any progress, or are things getting worse? So we hope to add that perspective very soon.
Thank you.
Dr. Chug, I wanted to ask along those lines, as we were doing the ARISE diagram planning, and we looked at the data on the dashboard regarding disparities by age, I remember looking at the accumulated numbers since the beginning of the pandemic, and although what we're looking at is horrible and needs our urgent addressing, that's the banner for our work today. When I compare it to the kind of 3-year running totals, those ratios were really gut-wrenching, much worse in the 3- and 4-fold. So I'm wondering if that means that in 2020 and 2021, the gaps were quite large, and now in 2022, we've seen a narrowing, although I can't use the word narrow because that's not narrow. It's still an enormous discrepancy.
Agreed. No, I think that's a valid observation. Thanks for sharing. And we hope to have a little bit more clarity on that as we break it down by year. So I appreciate that there are a lot of questions, and I will defer to the group to help address those, because I think this is, we just wanted to share the data, and thanks for the excellent request. And we'll continue to work to support your efforts. Thank you. Becky, anything else? Anything I've missed?
No, thank you. And I will say, yeah, there's a lot of questions in the chat, and it's where we're going. So if we don't get to your question by the end of the meeting, let us know, but I'm confident we will, hopefully. Thank you, Rashmi.
Thank you.
I hope you don't mind if I pose a hypothesis at the close of your presentation, Dr. Chug, and that is that there's been an incredible amount of work in DuPage County, especially with the folks in the room here municipalities and organizations that have trusting relationships to do education and vaccination. And my hypothesis, the thing that I want to hold on to, is that that's what has made a huge difference in 2022. Of course, we're going to await your more detailed and expert analysis of what's going on, but I take this as a sign that we're moving in the correct direction with this group, and we want to keep strengthening the things that are working while we add layers of new things and new focus, as you gave us today regarding the booster. So there are a number of questions, and so let me check. What we are set to do right now is move to our next agenda item, but I want to not lose the questions that are kind of in the way. Our next agenda item is going to be looking at coalition focused areas of discussion. And Mila, we're going to ask you to give us a picture of 2023 and lead that discussion. But I wonder if there are a couple of the questions here that we should address at least at a high level before we move forward. And Annie, Kim, you've asked the question, how is DuPage County tracking social determinants of health? And I think probably as a prelim to Mila's conversation or discussion with us, we should probably at least give that a look. And this is going to be a group entry. I want to invite anybody on the call who's following these to talk about what's the way in which you're doing this.
I'll just put a shout out in the discussion for Impact DuPage. That's probably one of the most robust ways that we have of assessing where we are on social determinants of health, and also looking at particular both health conditions and conditions of living through the filter of race, ethnicity, age, income bracket, etc. It's not perfect. One of the greatest challenges is probably that the data doesn't commonly come to us in real time, that we have to wait a bit of time to be able to get an answer. And so we can't necessarily see what's happening today, but rather see what's happening a year, 2 years, or 3 years ago. Nonetheless, it's a powerful tool that not a lot of communities have.
Yeah, thank you, Kara. And I will say, someone mentioned, I think it might have been Annie, but I can't scroll that quickly. But the Healthy People 2030 goals, for example, are great. And there are measures on Impact DuPage that actually compare how DuPage County is doing compared to national data. So I'll put the link for that specific page in the chat. Julieta, yes, I can add you to the Impact DuPage newsletter list. But the other part is that, to Kara's point, that we don't always get the data, as fast as we want it. We also have the opportunity to ask for data that maybe we don't have. So we actually just added a couple of measures related to, I think it was language spoken at home or something with languages, because we needed it for a project. And so if there are things on there like Healthy People 2030 just added some new measures that they didn't have in 2020 that are related to social determinants of health. And so if you notice something that's not on there, please email me and let me know, and we can do our best to see if it's something we can add, because there's a lot of measures on there. And so we just want to be responsive to things that people might need.
And I wonder, Kara, if I could ask you for the 30-second description of what is Impact DuPage. Step back from knowing that it's a site where we can get data.
So the way that I describe Impact DuPage is actually that it is two things that are sort of bundled together under one umbrella. And the first is that Impact DuPage is a collective impact group, a committee that is comprised of different stakeholders, both health and human services in the community, working together, setting key goals, and then measuring progress against those goals on 3-year planning cycles. But the other piece where I think in some cases people are more familiar with Impact DuPage is that it's a website with backing primarily from the health department, but also again from a number of key stakeholders in the community, and that it is a very robust set of measures that allow us to look at social determinants, that allow us to look at data at the county, at the municipal, in some cases at the census tract, oftentimes at the zip code level, also allow us to map disparities across the community, and really show us a picture of the health of our community on a host of measures. Some things that you might anticipate, like vaccination rates or health insurance status or heart disease, but also things like food insecurity or housing burden cost. And it's something that we've invested in as a community over the last 10 plus years, I feel like. And a number of folks on this call are on the steering committee for Impact DuPage as well. It might have been 45 seconds, sorry.
That was perfect, Kara. 15 seconds more. Julieta asks if Impact DuPage has some kind of a newsletter communication for folks who register to use the site.
Well, we haven't sent one since before COVID, but the goal for 2023 is to send some. So I will add you, Julieta. And anyone else, we can put that in the meeting minutes, how to sign up too.
Very good. All right. Thanks so much for that recap. And Mila, could I invite you to talk about discussion areas for 2023?
Absolutely. Thanks, Dave. Good morning, everyone. It's great to see all of you and Happy New Year. As we look at 2023, I was just taking a few minutes to look back at sort of where we've been. And if we look back and think back to our call to action initially for this group, and the overview document that we have about all the activities and the strategies that we employed to do the work and address COVID-19, many of them still apply. I mean, we just talked through, once again, we're talking about a vaccination rate that is not where we need it to be, and impacting outcomes and shining light on disparities that still are existing in our outcomes. So I want to just take a minute to talk about the 3 call to action bullets that we had, and then we can talk broadly about what our interests are for 2023. And I think this will probably be part 1 of a discussion, because we don't have all of our valued partners on the call today, and we can revisit it at the next meeting and give it a little more shape with some activities and programs and things that we want to implement to move into the year. But back when we first started, we looked at reducing the disproportionate burden of COVID-19 in our populations. And we talked about that using metrics that our CD-EPI team provided, that Chris and Emergency Preparedness brought forward to us monthly. We looked very closely at those metrics, outcomes, and vaccination rates. We also broadly were looking at how to address health disparities and inequities through a health in all policies approach. And this is something we even looked at last month when Derek spoke about how to have a policy and really employ putting the policy into place when looking at heart disease and all of the risk factors that go along with those disparities. And then lastly, we talked about developing a strategic plan and metrics, which we did and continue to check back on periodically. And then from there, we had focus groups and town halls. We stuck closely to the COVID response and prevention, treatment, vaccinations, and all the things that went with that, but also took time to look at important trending issues like monkeypox, like human monkeypox, and the baby formula shortage and things that really impacted our communities. So as we look at 2023, this would be a great time to discuss amongst our full group where we want to go, thinking about the data that Dr. Chug just shared, both specifically about COVID-19, and then also the risk factors, diabetes, heart disease, the severe illnesses and chronic diseases that impact those outcomes, which we haven't had the time to really get into the focus group areas or bring other perspectives to that. So I want to pause my conversation there and ask you guys for some input on what you think moving forward. And I'm looking at the chat. I see some stuff there too.
Mila, let me jump in first, maybe for some context. It's really helpful to look at these three kind of origin areas that take us back over 2 years. And I look at this and real quickly, I look at number 1, that's been everything we've been about. And I look at number 2, this is a reminder that even back at the start, we understood that looking at COVID-19 disparities meant we needed to look more broadly. And that's a pathway that we're on right now to expand our ability. And then number 3, the strategic plan. We're now 4 months into a project to develop that strategic plan. We've got this driver diagram. We've had the learning session a couple of months ago. We'll have another one at the end of this month that's known as the Chilla. One thing I think about when I look at this is to say, okay, now that we got 2.5 years or so, what was missing from these first 3 that need some attention? Or when we look at these, where are we maybe not satisfied that we should be adding something else on there? And I really like what we're doing now with our strategic plan, and that is a constant renewal. We're asking ourselves again, who's missing from the table? Who needs to be here? How can we refresh our view of those who've been most harmed by COVID and those who experience the highest level of disparities on other health issues as well? So maybe that would be one I'd put on the table, the constant refreshing, the replenishing of our vision for who should be here.
I find it not discouraging, but I feel like as we think about 2023, the fact that we still can't tell the story of what's happening with our Middle Eastern and North African neighbors because the data doesn't give us that level of granularity is substantial. And when you look at the numbers, like the fact that the data for those age 60 and over suggests that individuals of Asian descent are sort of tracking along with the overall population, but then you find yourself with the unanswered question of who is that really speaking about? And if you were actually to look at who that was actually speaking about, would the story look the same? So I think one of our opportunities is continued advocacy and partnership with our health partners and others who are in a position to begin to track that data so that we can answer the question, because right now we have supposition, but we don't have answers.
I like in the chat, we have some feedback on the health equity plan is a perfect fit for a strategic plan. And from Dr. Asfar, more outreach, as David suggested, communication and a comprehensive data set. When I see the outreach part, and when I was listening to the report that Dr. Chug gave, I kept thinking, when did we stop or pause maybe the education and big push for vaccine and vaccinations? I know that Immigrant Solidarity and many of our groups are doing clinics still, and ICNA Relief is still doing mobile care, and all those things are still happening, but the enthusiasm that we all had, and our, I think, healthcare providers too, for making sure people were vaccinated and going the extra step on doing that education. Some of the outreach comes to mind, and some of the work that we had done with Mimi about maybe why people are not seeking that bivalent dose, so that we can understand it better and pivot our education. And flu, yeah.
To those who, there are some folks who've been having trouble staying in the meeting and are returning, I want to let everybody know that what we're doing is talking about areas of focus for 2023. And Mila grounded us by sharing the 3 first areas of focus that we identified 2.5 years ago. And those are in the chat: reducing disproportionate burden of COVID-19. Number 2, broadly addressing health disparities that are related to COVID-19 with health and all policies approach. And number 3, the development of a strategic plan. And so we're looking for feedback on those original goals. What should be adjusted, changed, built different in 2023 as we move forward?
Dr. Osvar, I see your hand is raised.
Yes. Good morning, everybody, and Happy New Year. So good to see everyone. I was looking at the death toll in United States, and it was really 1.1 million. And I think we should keep that number in front of us all the time. There was a huge, trauma which our country faced and our county and our neighborhood faced. So keeping that in mind, I think we should plan smartly. We should have some net target set for 2023, which we should evaluate by end of this year. For example, if we are saying, okay, we want to communicate with more or do more outreach. So let's figure out outreach where, and then are we successful by end of the year, we should evaluate those goals. It should not be like a, vague type of a plan. We should have some specific goals and target for sure. If we are thinking of data, we should plan like, what are we trying to improve in data? Which areas? And we should have easy goals, easy targets, but achievable, and that we should evaluate.
Thank you, Dr. Osvar. I think that in a few minutes, we're going to talk about some opportunities to track and evaluate what we're doing, but noted that specifically about communication and outreach, if we're looking at populations or geography or how we're doing that, we've noted that. Thank you.
Yeah, and Mila, this group which we somehow created, this is very important. I think we should not lose this communication. Whatever we have right now, continuing with this one, this we should not lose. So we have to make a plan that there will be weaknesses. There will be some communities maybe having different type of challenges, and we might, we should continue our efforts to keep this and then grow this group. This will be, I think this will be one of the most important thing. And then data and many other things will come.
Thank you. Chris?
Yeah, thanks. One of the things I'm proud of working with this group to do is really get, vaccines available to people, tests out, masks available, all the stuff that we were able to provide communities. And I hope we can continue to do that now. It feels like, well, do people still need that? Yes, and we've got supplies. We want to get them out. We want to get them in hands. I'd also love for 2023 to pick some policy changes too that might, encourage sick leave policies and time to be home when you're not well. Look at environmental changes, air quality. I think we're learning more and more about the spaces people spend time, whether it's school or work or community settings, making sure that the indoor air quality supports good health, both for viruses and for allergens and other environmental things. And then the last one I think is going to be really important from our public health perspective is the continued challenge about vaccines and other things that we know work based on 100 years of scientific evidence. You see now that the NFL player, immediately after that happened, it was like, oh, it must have been due to the vaccine. And I think we're going to see more challenge around that for measles vaccines, chickenpox, flu, and so really finding ways to help people learn about vaccines, understand the place for them, and know where to find good information and look at the policies around that too.
And we're seeing workplace safety added to that list of policies, Chris, in the chat.
Dave, could I just pause for 1 second? Because Sarah had brought up funding earlier in the chat. I'm looking at the work that we've done, and when Chris mentions air quality, and I know schools have had opportunities to improve air quality and federal funding to make those changes. Is there still funding, or do we think that there's still funding coming to make some larger scale changes like that with environmental risk factors and things? Because I think Michael brought up the apartment living and people that are living in congregated settings and the risk factors that they may have.
Let me make sure I understand your question. You're saying, do we see funding in the pipeline to
Right.
address those quality issues? And
Yeah, some of the knowledge about that, those opportunities that might be even at the municipal level, or that we can bring to through housing. Just think of all of our people that are living in congregated settings that also have, severe illness in their families, and if housing can be improved.
Chris, I know there's some
yeah.
discussion about, updating the air quality standards for buildings, commercial buildings, and I don't know if it'll get to homes and apartments, that kind of stuff, but there's talk about updating that. They're based on, old data, and I think we've learned a lot through COVID. So I don't know if there's specific money now, but I expect that there will be if those standards change. There may even be some, advocacy to change those and then to make funding available so that you can help these facilities and owners and operators get there. Nice to have a standard, but if you can't improve the system, it doesn't really help. So I think it's an area to watch for sure. Evan, are you seeing anything on the municipal side, anything in the government world?
We're actually not related to indoor, but Bensenville's in the process of installing 3 outdoor air quality monitors located by our rail line, by the runway, and by the tollway here in Bensenville. So we can start getting baseline data for what that looks like.
And Tyrone, I see your hand up too. I don't know if it's about this question or a different one, but I wanted to just acknowledge your hand up.
Oh, I just wanted to share with the group, how happy we are with the DuPage County NAACP to participate with this organization and all the members. We all had an opportunity to go out and collect some data, and from our data collection, there were 3 common themes, and I just wanted to touch upon the most important theme to us, and that was vaccine hesitancy. And the reasons why there was a lot of vaccine hesitancy with the misinformation, disinformation. In conclusion, our goals are to try to find positive, factual information to champion so that when we go out into these communities doing our outreach and education, we today are looked at as people that can deliver factual information. And I think this group for providing a lot of the data, a lot of the resources, for us to go out and deliver this factual information, because that was really key, that people in our communities see us and can perceive that we are going to deliver that factual information. So this group is a really great resource for us, and we're happy to go out and deliver that information that we get from this group and our conversations. That's what I want to add and share.
Thank you.
Julieta, I see your hand is raised as well.
Yeah, this touches home here, where neighbors had their apartments burned, and here in West Chicago, and many things that the apartment complexes need to make sure they're keeping up, the landlords, and that we're seeing that they're not being done. And I would be willing to volunteer to advocate for these changes, because it shouldn't, there could be funding from the government and everything, but it should be I believe it should be a law, a regulation that these landlords have the places they rent habitable for everyone, you know, that there's safety, that there's good air quality, and you know, that is adequate for a human being to live, especially if they're families with children and seniors. Anybody deserves to be able to live in their apartment. They're paying rent. That rent should be enough to have the landlord make sure they're living in adequate conditions. So I'm willing to help volunteer as an advocate for the betterment of the conditions in apartments, because here in West Chicago, I'm sorry, but they've been deplorable. They have. Thank you.
I just wanted to make a comment. Someone a few moments back had spoken about trauma, and all of us recognized that there's been a lot of trauma associated with the last 3 years. And the consequences of that in terms of the community's mental health are significant. The good news is that there's been a great investment by the county and by other to try to increase and make more robust the mental health resources. But I find myself wondering whether or not those resources are available equally across race, language, ethnicity, language preference. And I also think we just really need to do work, and it may be part of the work of this group, to normalize that conversation and to really invite people to share how they feel, not with sort of the, you know, we've all gotten used to talking about COVID in a certain way, but really going a little bit deeper and understanding who's thriving, who's surviving, and who's really languishing, and what we can do to make that better.
That's a good point, Kara, because we really did not we didn't have the time or the perspective to get into the emotional toll and the trauma piece.
And I think some communities are more comfortable talking about it and some are less. And I feel like the consequences of not trying to make everyone more comfortable talking about it are going to be significant and long lasting.
Evan, thank you for noting the air quality policy dilemma, that as we seal up our buildings and there's a financial incentive there, we're also reducing airflow. Mila, I would love to just touch base with Fabi and Dawn. I know that you do your own community-wide assessments of living conditions and health conditions, and I wonder what your thoughts are from the healthcare system perspective about the things that we ought to be focusing on, or does anything here kind of provoke you or evoke thoughts in you about the way your systems are responding?
Aisha too.
Oh, Aisha, I missed you. Sorry, thank you.
I can share some thoughts. You know, as we were kind of talking, both of the priorities that we identified and committed to in this last CHNA cycle with Impact DuPage are exactly what we're talking about, right? The mental health, looking at the prevention and management of serious illness, which includes COVID and includes chronic disease. And I think that that's something that really kind of sticks out to me, thinking about the data in terms of hospitalization and mortality, specifically for diabetes and other chronic diseases. Diabetes, we know, is another risk factor, right? And when we looked at the data, that we saw those disparities amongst African Americans and Latinos, and the same disparities that we see with COVID, right? And we know that having diabetes or other chronic diseases, again, impacts COVID-19 as well. So just keeping that in mind, I think is really important, addressing chronic diseases as COVID kind of took over our focus of a lot of our agency's work. Chronic disease management kind of was pushed to the back burner. And so I think that's really important to just provide those resources for folks to be able to better manage their chronic diseases. And actually both for our hospitals in Glen Oaks and in Hinsdale, those are the priorities that we've committed to, and we're in the process of developing our community health implementation plan. So those are, again, priorities that we will be working on and look to partner, with our community partners in addressing those needs. Thank you.
Thanks.
I was pulling up information while Fabiola was speaking, but as far as Northwestern Medicine goes, some of the work that's taken place from the Community Affairs Department, if you will, related to the Community Health Needs Assessment is very much in line with what all of you are speaking about. But I think that our priorities are zeroed in or focused in on access to healthcare needs, mental health and substance use disorders, and social determinants of health. And I think these are not new to our hospitals or our healthcare system. What I think is happening, if you will, in our system is we are historically, community affairs would work on these initiatives, and it would be how we partner with all of you, organizations like all of you. What's happening now is internally much work is taking place to assess the needs of the patients at the bedside or in the clinic. And so for the first time, we're collectively working on addressing these issues, not only just from our community perspective, but also with our patient population. And so we have undertaken in the last couple of years a large internal screening effort for all patients that come to either our hospitals or our clinics. And we are asking them very targeted questions on what their status is related to a medical home, medication affordability, transportation, food insecurity, housing, and then mental health and social isolation. And so then the approach is to assist people in getting the resources they need. If it is something we can do, we try to assist at that time. If not, we refer to other agencies. So it's we have a lot of data we're capturing, which is very exciting for someone who's been doing this work for a long time, that it's not just one little department, it's everyone in our system is working towards improving and making a difference in treating the whole person rather than just episodic situations. So it's a long time coming, if you will.
Thank you. And I want to make sure, Aisha, are you with us at a mic? Did you want to weigh in here also?
Hi, good morning, everyone. I'm here.
Good
I'm
morning.
actually in the car, so I missed, and my audio keeps going in and out, but I missed part of the question that was originally asked by Dave. I know I heard some other comments about CHNA, so I could talk about that, but I want to make sure I'm actually answering the question that was posed.
Oh, good. Thanks, Aisha. So we're talking about our priorities for 2023, and we took a look back at where we started 2.5 years ago. And we've been going through a list of things that folks would like to see on our radar screen, like policy changes, like addressing air quality, like a collective push for grants and funding, specificity in our goals that are measurable. And I wondered, because Advocate Aurora and our health systems do your own health assessments, do you have thoughts about what our priorities ought to be here and how those align with yours?
Yeah, thanks for clarifying that for me. So we did just complete, what was this? December of 2022, our community health needs assessment. So for Good Samaritan Hospital, we prioritize, we have 2 health priorities. One, we're calling it health, wellness, and nutrition, which looks at multiple things that would kind of affect an individual having kind of an overall healthy lifestyle, whether it's access to healthy foods or poor nutrition, physical inactivity, looking at diabetes and chronic disease management. And then we also are prioritizing behavioral health, which really is addressing two issues. So mental health and substance use. I'm working on completing we call them the community health improvement strategies. So we haven't identified like which exactly priorities or strategies we're going to be working on, or how we're going to address the issues that we do see in the community. But I know that some of the stuff that I've been listening to in today's meeting, it does align with what we're trying to do at Good Sam. I personally would love to talk about air quality and see how the hospital can support in that area, as well as the health in all policies. So yeah, Good Sam, we're happy to help and support, and it does align with the work that's being done. And of course, grants and any funding is always helpful in the work that we do.
Thank you.
Thank you.
Mila, how are we doing?
I think we're doing great. I'm making a ton of notes and looking at the chat to make sure we've gathered everyone's perspective. And I know there's a number of us that can't, use their microphone. So I continue to put your comments into the chat. I think we can gather plenty of information that way. We'll have the recording to look back on, but I'm hearing a lot of good new content for 2023, but then also, steadfast on the MENA data collection and looking at our data and adding some maybe depth to some of what we've seen before with either apartment living or length of time in DuPage. These are maybe things we can get through focus groups or survey data or things that we've done to bookend what we get from our CD Epi folks. So I think this is great. I'd love to touch back on it with a little shape to it with you in February. Give everyone a chance to sit with it a little bit, and maybe some of our partners that aren't here today, Jan and Reverend Briones come to mind as folks that we don't have voices today. So thank you very much. And I think our hospital partners today, it's been really great to hear from them. So lots of opportunity to talk with them. And I'm thinking a little bit about our federally qualified healthcare centers and making sure that they're involved in the mix too. So please keep that chat going, and thank you so much.
A quick comment as people continue to brainstorm during and after the meeting. As a consequence of our participation in ARISE, we have a few resources that might support our being able to answer some of our unanswered questions. And I just want to keep that on people's minds. One is that we have some dollars set aside. It's written into the grant as focus groups, and focus groups may in fact be the right approach, but there could be other ways of surveying or reaching out to the community to try to get more feedback about what's needed or what's relevant. And the other piece that we have some existing dollars for is interpretation and translation. So where there are places where communication, education, or outreach is challenged because we don't have resources available in all languages, those are places where we actually have not dramatic funds, but funds that could make a sizable difference in our ability to reach out to populations. So if you have an idea, let me know, let Dave know, let Mila or Becky or Joel know, and we can try to put that on our to-do list as well.
And Kara, just to belabor that a bit more, I mean, that's a real opportunity for a policy change that we can look at and how we go about translating documents and communications, not just documents, but all of our communications and health literacy, and looking at that. So that would be a great opportunity to address health equity in a policy. So thank you.
Thanks, Mila, and thanks everybody for that incredible input. Three of the things I heard raised up are things that we have some initiatives underway, and we're going to be addressing those in the next elements of our meeting this morning. I want to invite Becky to the microphone to talk about results-based accountability.
Thank you, Dave. So we have talked so much about so many things that we can do in 2023, but I've also heard a really strong desire to talk about like, how are we measuring those things? So I think I want to propose that results-based accountability is a tool potentially that this group could use to sort of create some structure around some of these goals that we want to take on in 2023. So what I would love to do is I will share my screen and just show like a brief overview of what this tool is, how we could use it, some examples of how other groups in DuPage have used it, and kind of get your thoughts on like, yes, we think this would be relevant for heart, or no, we hate that, let's try something else. So let me know, I will not be offended. I will share my screen now and just go over briefly what the tool is. Okay, so basically results-based accountability is a process that's going to offer us a disciplined way to think and take action to improve the conditions of the people that Heart is trying to serve. What I like about this and what other groups have liked about it is that it's simple, it's common sense, it's not so public healthy like some of our public health friends, myself included, likes to get complicated, but this one is really simple and not a lot of jargon, but it also allows us to use a data-driven decision-making process. So we will be able to take the data we heard this morning, as well as other data points people want to collect, and actually use that as part of creating this plan moving forward. All right, so why? I already mentioned it uses data. It also uses transparent communication. So all of us would have access to like what these plans are, what the goals we all set together are going to be. It will help us work together. It allows, because it's not super structured, it allows for creative thinking and things like, because we're all in different sectors, I think it lends itself really well to that too. It's gonna, like I said, give us structure, a simple step-by-step process, and it will not hopefully slow us down. So it gets you from ideas, like all these great ideas we're talking about today, to actually implementing really quickly. All right, so what do we mean when we talk about it? So there's different words that may be a little bit jargony, or that people are maybe thinking about differently. So I'll just go through those really quickly. So when we talk about results, we're talking about a condition of well-being for whether that be children, adults, families, or communities. When we say the word indicator, that means a measure that's going to help us quantify the achievement of a result. So those are the things that we are going to pick to show that we as a group are taking on shared measures to create change. And then performance measure is a measure of how well a program, agency, or service system is working. So this is some examples. So for example, a population could be all Illinois residents, could be the entire DuPage County population, it could be all Bensonville residents, if we're choosing a specific town, for example, or it could be a race ethnicity population. Population results. So we've talked about some of these today, like clean environment, vibrant economy, a safe community. Like what are we trying to do? What result are we trying to get to for the population that we end up selecting to focus on? And then the indicators. So as a group, we would all select which indicators we're kind of using to measure that we are making progress. So that could look like, for clean environment, it could look like a % of days below air quality standards. For employment, it could look like what % of adults are employed. And then for safe community, could look at an indicator that we have % of residents who feel safe. So again, this is just super high level examples. So there are indicators that you can pull that are about all of DuPage County. So those would be like a lot of the measures that you can pull from Impact DuPage or that we can pull from the census. They're ones that already exist. But there are also things that we can measure specific to like those people who are served by Heart or by a policy that Heart would create. So I'm not expecting anybody to be like a results-based accountability expert after this. This is more to show kind of what we could determine if we were to use this model moving forward. So some of the things that we could look at is like, how much did we do? Like, how many surveys did we have that were able to include the MENA population, for example? Quality could be like, how well did we do it? So are people saying that something went well, or are rates increasing for a certain thing? And then impact, is anybody better off? So like, what's the population impact overall? Okay, this is just, I find this confusing, so I kind of want to skip it, but it's basically just showing that same thing again with broken down by examples. So that I kind of just gave. So that's just, we could, if we decided to use this, we could use this as a guide of like what some things you might want to include would be. And again, this is just kind of talking about some language that we might use. So there are things that heart would contribute to moving some of these factors. Like we talked a lot about like some different policies, or even things like vaccination rates. Like we don't have, heart does not have control completely over what those things would do. But we could contribute to that. So there's, you know, population accountability there, or we would have a role in that. But then there's also performance accountability. So things that heart is directly responsible for moving those factors. And so things like, I think Tamika even, or maybe it was Simon, asked like, it was Tamika, it was about the vaccination data that Rashmi showed, like, but why? And that's some of what this will dig into, is like, okay, we have the data. Now, like, what do we want to do about it? What specific action steps are we going to take, and how will we measure that? Okay, so this is just another example showing a result and some population indicators. So people living with or at risk of behavioral health conditions are healthy, have satisfying social relationships, and avoid criminal justice involvement. So this is an example a group could have picked. That's what they want to see. Okay, great. How do we get there? So the population indicators that they have picked are emotional health rated by level of mental distress, daily functioning rated by limitations due to physical, mental, or emotional problems, reduced or eliminated alcohol and substance use. So just giving an example of kind of what that could look like. Okay, so another thing I like about this is that we have groups in DuPage County that already use this model. So I wanted to show you some local examples. So We Go Together for Kids is a group based out of West Chicago. I know Molly is on the call, so Molly, please feel free to jump in, but they have launched their new website, and it's linked at the bottom here. I'm not sure if you all can click on it, but when the PowerPoint goes out, it should be hyperlinked. They use this model to basically take all of their categories that they want to work on. And yes, and we also have some WeGo members on as well. So I screenshotted an example from their website. One thing they want to work on is, or one of their categories is academic achievement. So basically what they want to get to, or their like high level goal, is West Chicago children and families have access to continual learning opportunities. So some of the things that they're looking at is out of school time and after school programming. Like what do the options look like for that? How many kids are in those things? What programs are available that offer those things, and kind of tracking some metrics around that. Adult education, and then summer learning opportunities. And so regularly that group checks in on, like, there's a subcommittee that works really deep into that. And they kind of measure the results over time and kind of talk about the data they're tracking, as well as what things they need to adjust. Michael, I see you have a question.
Yes, ma'am. Are we looking to the community colleges to help with these strategies? And I looked at the summer learning programs. How do they have any idea of how they plan to go about attacking those strategies?
Yeah, so I'm sure that Molly would be, I'm volunteering you, would be happy to send you information on how specifically how they're addressing these strategies. I'm showing it as kind of an example of just the structure that they used. So I mean, if you're interested in learning more specifically on summer learning opportunities, I'm not the right person to answer that question specifically. But if you want to connect with Molly, she would give you all the details there.
Okay.
Does that answer your question with like not an exact answer? She put her email in the chat.
Okay, because I'm a big advocate of after school programs because and learning also and the summer opportunity.
Yes,
because
all very important for sure.
Right, if we can engage not only the children and the adults in educational, positive educational activities, we should see some benefit on the other end with, less behavioral issues in the schools, more engagement, higher engagement, just an overall healthier community. So I like those strategies. I just wanted to know a little bit more about them, how and what we can do to help in them.
Yeah, exactly. And I think that's, another strong part of this group is that we do know that we can pull from so many other community groups in our county. And so if Heart wanted to do something similar to, any of the things that are already happening, that is what this group is about. So thanks for asking that question. So the other example is from the Addison Resources Connect group. And they use they're actually we're going to redo the results-based accountability goals in February. So they did theirs before COVID, and now we're going to be reevaluating them. But similar structure, they have different subcommittees who work on different areas of focus. And so this one is around Addison businesses and other community service providers are actively engaged in the work of Addison Resources Connect or ARC. So some of the specific things that they were going to do on that was like promoting ARC's mentor programming, using business and organizational wellness programs to encourage this community volunteerism, partner with the Village of Addison's Workforce Development Committee to promote ARC and its programs, and using the Addison Public Library Small Business Saturday program to promote the ARC opportunities as well. So that is a very quick, very brief overview of the results-based accountability. So I will pause and just get people's thoughts, I think, on what people want, if people want to use this model for our group moving forward.
Becky, just curious, who developed this framework?
So a lot of those slides were from Clear Impact, but I'm not sure the exact person's name who did it. I know DePaul does training, and there's other like professional development places that do training in the model, but I can see if I can't remember off the top of my head. I can put his name in the chat.
I think I see a Tamika endorsement here. Tamika, am I reading that right from the chat? I'm not sure if the comment was for RBC.
Typically, we go with using the Mark Friedman model, and he's sort of the expert, although I don't know if that's who did the training, but that's the tools that they gave us.
Thank you.
And we can bring back some more information and examples, either through email or at a future meeting on how this works. I think we've talked about some good ones, but there's a lot of good opportunities here to show partnerships and be able to look at individual indicators and see where our progress is frequently, which is great, because I think sometimes, looking at it once a year is not what we've done. We've always gone back monthly to look at different outcomes and indicators, and this allows us to do that. So thank you, Becky. This is great.
And I want to also put a sense of urgency to Becky's question about what you think about this, because Kara is going to describe to us in a couple of minutes the workshop that we'll be attending with our partners across the state on January 19th and 20th. And one element there is going to be looking at how we're setting goals and collecting data. So if you have systems that you've worked with in your community collaborations that you think should be in the mix, this is a good time to bring that up. Or if you like the RBA, this is a good time to say thumbs up, because we'll probably be we'll be pushing that needle when we get together at the end of January. And all of our RISE funded partners will be with us for that event.
I see Mary's got her hand up.
Thanks, Mila. I just have a comment. I like the model very much. I just think when we get to the point where we are sort of identifying our goals and strategies, that we make sure, as Dave said, we're talking about data collection. I think we have to have, if our point is to have measurable goals, those goals have to line up with our ability to measure whatever it is that we're trying to impact. So I think when we talk about some of the examples were sort of population-based, population level indicators. I think our ability to collect that data on a regular comprehensive basis might be challenged. And so I just want to make sure, I like the model. I think it's very simple, easy to understand. I just want us to make sure that we set goals that we have the ability to measure.
And that we have the ability to actually influence and change.
Right.
Yeah, I agree with you, Mary. Yeah.
Absolutely. And the model actually sort of demands that, which is not to suggest it's easy. It means that if you can't measure it, then it isn't an appropriate goal from the model's perspective.
Right. Thank you.
Thanks, Mary. Sarah.
I will agree with Mary's comment. I've been part of We Go Together for Kids for many, many years, and this has been a really great model for us there. But I will say we do have caveats, or we've talked about this in the past, because some data that is measurable will not change rapidly over time. So we've had the issue of when we go to funders or we go to other partners and we show some of the metrics, and they'll say like, oh, you haven't moved things, or numbers have gone down. So we do a lot of work in small groups around social determinants, other factors in the community that will affect data points. So there is quite a bit of qualitative information that goes along with it. And from the Healthy West Chicago perspective, we adapted this in 2016 when we launched that initiative. And we also kind of use this. Our big hiccup there, to Mary's point, is that we have a really hard time getting data from partners. We had really good tracking, and then COVID-19 hit, and then it was harder for the health department and the hospital to give us data, which we understand, but then we have a data gap. We also utilize BMI data from the schools, which is really our only indicator that exists to measure things. But there are years that for a variety of reasons, the schools don't want to release that to us, or we don't get it in a timely manner. So I do think this is a great metric, and it's helped us a lot in both instances in West Chicago. But I do think that if there's ways on the front end for us to front load qualitative measures or qualifiers that help us know and have reasonable expectations about what we'll get out of this, it does make it a more fruitful endeavor.
And I think, Sarah, that's so related to what you put in the chat about collaborative funding, because when we applied for a RISE, we used a lot of like process things related to the structure of heart and like, how many members we had. And, we used a few COVID related measures, but I think if we're able to get ahead of like showing funders some data or having that ready, that when a grant becomes available, that the group will be even better positioned to apply for funding collaboratively. That's so helpful. Oh, and the other thing I was going to say is the results-based accountability. What I like about it too is it's easy to have goals also around like the structure of your group. So like a goal, like one of ARC's goals is around funding. So like there could be a goal around, something around collecting data for funders or apply for, one grant as a coalition or something like that, where there's somebody monitoring grants, things like that. So it's not only about affecting the population, but also about like coalition capacity as well.
Dave,
Thanks.
I'm wondering if we can transition to the next piece because I want to make sure we get people's feedback and folks are leaving.
Yeah, thanks, Becky. Kara, please take us into Arise grant updates.
Sure. So I'm going to go through sort of 3 topics, but pretty quickly. The first is I just want to give everybody some feedback on where we are on the event that is being hosted here in DuPage County. We are not ourselves the hosts, although I think we think ourselves as co-hosts. But this is the Chilla for the statewide Arise program, but they are hosting it in DuPage in Naperville at the NIU campus. We, I think, had probably unrealistic hopes, and I really want to acknowledge Arise for their flexibility in terms of allowing us to have more attendees than they are having from any other organization, but still probably less than we would have liked because we have 8 funded partners on that project, and typically they only have 3 to 5 attendees from any one project. We had to make some compromises, and we're really, really grateful that we have attendees from each of our funded partners. So that includes NAACP, Health Equity Advisors, SSIP, ICNA Relief, Immigrant Solidarity DuPage, DuPage Health Coalition, the DuPage Federation, and of course the Health Department that will be physically present for that Chilla, which is a 2-day event. But separately, the Arise folks have made a commitment, and Becky will be sending out to everybody a copy of the agenda. I think actually I'm going to ask Becky if we could do 2 things. If we could send a copy of the agenda now or relatively soon so people get a sense of what's happening at that event. But as we get closer to the event, we will send you a refreshed copy, which will have Zoom links. There are 2 different ways that folks who are not going to be physically present at that Chilla can participate. Or 2 different components in which they can participate. One is sort of speaking from the podium, communications that will come from the Chilla leaders, educational opportunities where they would probably have the Zoom camera trained primarily on the person up at the front of the room. And there will be a number of opportunities over those 2 days for folks to listen in and or ask questions and participate like that. The other piece, though, is that we'll also be having breakout sessions over the course of those 2 days, and it will be our responsibility for those partners who are in physical attendance to create opportunities for our partners who are not physically there to also participate in a number of those. I think there are at least 3 different breakout sessions where if it's a topic that's of interest to you and if you have time available, we would welcome you to sign in, and we will have that camera on that small table that will include the other Heart members and encourage you to join us and give your feedback. But because we were only able to get 8 to 10 folks to attend that and could have probably had 3 times as many given the interest and robustness of this group, we are really actively thinking about creating something, and we wouldn't call it a Chilla, but think of it as a DuPage Chilla, a separate event, probably 1 day or at least a half day this spring, where we would like to have an in-person meeting of our broader group at a location, local and convenient, where we can really do some collaborative planning around where we want to go next, take some of the conversation from today, possibly look more closely at results-based accountability or other tools that we might use. And we think we have the funding to support doing that. And we also think, more importantly, that it would be a really valuable opportunity. A number of us had the chance to come together, I think that was in October, November, to see each other in person for the first time in basically 3 years. And we would like to be able to do that again and use that time for some purposeful and strategic planning as a group. So stay tuned for more information. Think about what would be most helpful to include. I think we'll have more opportunity to talk a little bit more about that, but please know that that's something that's on the horizon and something that we think would be really instrumental in our ensuring that 2023 and beyond continue to be productive for this group. So that's the first piece that I wanted to talk about. And the second piece that I really wanted to ask about is another opportunity that we have. The Arise project came forward to us and provided us some additional funding that would be able to support reimbursing individuals with lived experience that perhaps because of their work obligations or life obligations would otherwise be challenged in participating in this group. And we probably have the equivalent of something in the neighborhood of 500 hours of reimbursable dollars that we could apply to, for example, at that one-day event, inviting other individuals that perhaps have not participated in our work, but have stories to tell and perspectives that we value to join us for that day. Or similarly, for the heart meetings that go month after month, or planning groups that come about as a part of our work, to be able to invite more individuals with perspectives that we really need to hear and consider to be joining us. And so I want to ask the group to help us to figure out how best to both invite and enroll increased participation in this group, and how to extend those invitations, and then how to use the resources that we have. And I'll say that it is not a either or. And what I mean by this is as follows. We have groups that are on this call today where, as a part of the funding that they receive from Arise, they commit to having one individual join us. But as a matter of routine, they're having many people join us. And one of the ways that we might use this funding is to provide some additional support to those community organizations that are already actively participating, to help support on an hourly basis to effectively stipend their participation here, or to bring other folks from your agencies that perhaps haven't historically participated but would like to, and to also reimburse them for that time. The other group that I think would also very much like to include are folks that haven't been a part and may not be employed or full-time or significant volunteers within your organizations, but perhaps people you know and are aware of, whose voices you value and whose perspectives you respect, that you think would really add and contribute to this group, but who would need a little bit of money to be able to make that possible. The initial suggestion from Arise was that we would be able to reimburse folks at a $15 an hour rate for their participation in the group. But I will say that DuPage is a community that is more expensive than many. And from an equity perspective, it may make more sense to think about what we consider as a living wage here in DuPage, and to set the reimbursement accordingly, which would actually be a little bit higher than that amount. I'm going to be speaking to our Arise partners early next week to propose some different ways that we might use this funding. There's a total of $12,000 additional dollars that they've provided to us. They've said that we can use this funding for two purposes right now, which is to help to reimburse individuals with lived experience for attending our meetings, attending sessions, but also for travel expenses. So to support both those in this conversation, but others that we might bring in to ensure that we have the dollars to reimburse both their time and their travel if they were to attend future chillas with us, for example, et cetera. But I guess what I want to really hear from folks in these remaining few minutes is what ideas you have for identifying individuals who would enjoy participating, who would be able to participate, and who we might invite in the coming weeks or months to join us, both for meetings like this and also for longer sessions of education. Thanks, Dawn. Have a great day. What ideas do people have, or are folks on the call aware of individuals that they might reach out to invite their participation?
Hey, could
Jose,
I ask?
I don't. Oh, go ahead.
Kara,
Oh,
I
Annie,
thought-
were you coming on?
yeah, come on, Annie. I'm sorry.
Came and went. Jose, I don't know if you're available, but I will say that as I think about this opportunity, one of the ideas that come to mind for me is your Health Equity Academy. And I think I'm probably getting the name of it wrong, but I know that SSIP has been actively engaged, and I see Ashna, you're also here, and maybe you could speak to this as well, has been actively engaged in reaching out into the community and helping to rise up community organizers with the skills and tools that would equip them to be able to be advocates for change. I would love to talk to you guys further about bringing some of those graduates from your work into HEART.
Good morning. Yes, for sure. It's you didn't get it too off, Kara. It's the Immigrant Health Academy, and yeah, and we just wrapped up our they had 6 different modules of training, and I think it's either November or early December that they wrapped up, and now they're going into the action phase where they're actually doing a lot of the outreach. So I definitely would like to brainstorm a little bit more on how exactly, because there's 15 of them, so it's a bigger group. On maybe there's a subsection or even some of our community health workers that we could get engaged and plugged in with this group. I think it would be a good fit, but we'd like to brainstorm a little bit more on how that could work.
I love it. Yeah, I think that's a perfect application. I also think, Annie, of some of the immigrants that have partnered through their resettlement efforts with World Relief DuPage, and wondering whether you and your colleagues might be aware of individuals who would be interested in getting more involved in work like the work we're doing here. And I want to acknowledge that in some cases, depending on the country of origin, there could be language barriers. This is one of those great examples where if there was someone who was not sufficiently comfortable in English to be able to feel like they could participate actively, that we could actually take some of our dollars from the ARISE grant to ensure that interpretation or translation, more in this case, more likely interpretation, was available, so that they would be able to have that barrier overcome.
Annie, you're mute.
Thank you. I appreciate that. So can you please tell me again what the ARISE is?
Oh, absolutely. And I apologize. That would be jargon that a newcomer would not have. So ARISE is a statewide grant application. It was a competitive application that we participated in. To be perfectly honest, we didn't think that DuPage was a particularly high target candidate because there were other communities with lower rates of vaccination or higher rates of COVID than we were. But I think that because of the work of this group, really a testament to the ongoing work of HEART, we made a strong application. And so we were ultimately one of 15 communities that were funded with this what was initially a 10-month planning project. That has actually been renewed, so it will be funded for an additional 7 months after that, going until effectively December of next year. So we have a year's worth of funding that is left to us. And what it really is a coalition building effort, an effort to support coalitions like this one in being able to address not only COVID, but other social and health disparities. And so that what it provides us is technical assistance, the ability to come together with other coalitions to network and learn from one another. And then it provides us as HEART a bit of funding that actually helps to modestly offset the time and expense of participation from some of our community partners. So that's the ARISE in a nutshell. But when we wrote our grant for ARISE, we put aside a bit of money for focus groups and education. We put aside a bit of money for interpretation and translation. We put aside a bit of money to travel to these 2-day educational events. And then we provided modest stipends to several funded agencies. Because we were such a robust coalition, and because I think they thought that we were doing effective work, they came to us with an additional opportunity for some additional funding, and that's this $12,000. And they specifically requested that we think about using that funding to support both travel expenses and additional funding to individuals with lived experience of health inequity or disparity, to be able to ensure that all of the voices that needed to be a part of this conversation were. And that's where we find ourselves with some brainstorming to ensure that we are really bringing the right folks to the table and using those resources equitably and impactfully.
Thank you so much. About how many focus groups do you have right now then, or are you still?
So we haven't planned any focus groups now. That we actually have that funding separately. And so the question is sort of who would we want to talk to and what would we want to ask them? But we have funding, as I recall, for 30 or 40 people to participate in 2-hour focus groups. And funding, I think, would support at least 3 or 4 different focus groups, meaning if we had different language needs, it could be segmented that way. But then we also have this funding that would provide support for up to 500 hours of participation. And so imagine if we had an 8-hour event, you could have lots of people attend that 8-hour event and not even use up a fraction of the dollars that we had. But also we have monthly HEART meetings of 2 hours in duration. We could potentially have individuals that wanted to attend some of these 2-day events out in the rest of Illinois, and we would be able to support their travel and support their participation in those 2-day events. We really have a lot of flexibility. What we're looking for is interested individuals that would like to get involved, and then understanding that it is sometimes a privilege, that it is sometimes privileged to be able to participate in events like these, because people can't come to this because they have to work, or need to provide for their families, or whatever the case might be. We understand that. And so we want to make sure that that isn't the barrier to someone's participation, that we can, just as most of us are compensated for being here today, that we can similarly compensate them.
Thank you. I know that was a lot of information. And is this something I could have in
writing?
a link that I can pass on to?
Yeah, so I can absolutely, I think Amanda's probably pretty familiar with the backstory of HEART, but I could certainly follow up with an email that described what we're looking for and what we would be interested in our partners coming forward with recommendations around. And maybe that's the next best step, Dave and Becky, for us to send something out to the group and then invite people's feedback. But it really, just hear this as a request. I think we have a really generally broad and representational group here, but I think that there are probably opportunities for folks who aren't necessarily employed by community agencies or healthcare providers, but rather living this experience without perhaps working in this space. And those are the individuals that we would really love to have join us, as well as, again, looking at our funded agencies, the opportunity to potentially provide additional resources for those who are commonly sending more than one individual here, where the ARISE grant is not necessarily funding all of that participation. Oh, that's a great question, Tamika. I think we should probably talk more about it, but my short answer would be yes. I think youth would be a great addition. I think that youth is a broad category. I think that probably teens or young adults would be folks that we could really learn from and would welcome that if they were interested.
Great, thank you, Kara. That's what I really wanted to. But yes, you're right. Youth is. I consider myself young, so yes.
Yeah, I'm youthful. Come on. Okay, so I'll leave it at that. Where time is drawing short. But we will send an email, and please do think about who you know that might be interested in participating, and let me know that, and we can talk further offline. Thanks.
Thank
Dave.
you.
Thanks, Kara. So we know that's a takeaway for folks today, to be thinking about ideas, the ways that we could use this potential new resource in partnership with all of you. We're at 10:27 and we're at the close of our meeting, which is a time for meeting updates. And I'm sorry that we have left so little time for member updates. We've left so little time for this. I do want to encourage somebody, if you have something that you've been sitting on that you would like to share with us, something others need to know in this room, please, now's the time to share that. And I just ask you to be as brief as possible as we're close to closing. I hope I haven't discouraged that. Also, feel free to put it in a chat, because we'll circulate that chat after this meeting.
Maybe I'll jump in. There's an event we're having tomorrow. This weekend in our Latino traditions is the Three Kings Day. But tomorrow, my colleagues and I, from 5 p.m. to 7, we will be distributing toys to children. So we welcome everyone to look at our website. Unfortunately, I don't have the infographic, but look at our website, get that.
We lost
Julieta.
Julieta, but I'll say it's on the DuPage Health Coalition Facebook page as well. It's a really cool event that they're hosting.
Very good. Julieta, you froze, your image froze. So thank you for sharing that. I want to say to all of the folks who participated in today's meeting, thanks so much. We've had such great input and dialogue. And special thank you to Dr. Rashmi Chugh for making the data presentation to us, which grounds our work going forward. Thank you, Mila and Becky and Kara, for guiding us through essential parts of planning our future. And thanks all for your engagement. And I'm wishing you a safe and a healthy weekend. And unless there is something else, we are adjourned.
Just one quick question for Julieta. Do you need any volunteers or anything to come out and help? Or
we may have lost her, Michael.
I'll call her. I got her number. I'll just call her directly. Find out a little bit more, see if she needs some help.
Very cool.